Thank you. And let's give her a round of applause for her service. So welcome. Welcome to the Voices of Florida Women's Jacksonville Roundtable. Again, we are delighted you're here. We're excited for the day. As I mentioned, my name is Lori Day. I chair the Florida Commission on the Status of Women. And we're not only happy to be here together, but we're glad that we're together in Women's History Month. So that is just awesome. I wanted to recognize some of our special guests that are here today. Come on in. We know that there's folks that we're having some trouble with traffic. But some of my fellow commissioners are also with us today, and we have some award winners from our past that if you could stand as our commissioners from across the state and join us, let's recognize our team. I have the pleasure of serving with 20 amazing women from across the state on the commission. Before we get into the program too deep into our general session, I want to make sure we thank President Winslow. You have done an amazing job being our host here at Kaiser University. It's a beautiful setting, and we just are delighted that we're partnering with you on this event. And I would like to ask President Winslow to kick us off and talk about the importance of upskilling. Many industries and, quite frankly, technology within industries are changing rapidly. And as a result, the ability to upskill is a critical component of keeping competitive and being able to have control of your career. And so what I would love to hear from President Winslow is how upskilling and that being a crucial strategy would be an important part of women and their aspirations in the future.
Thank you, Chairwoman Day, and thank you so much. It is an honor to be here today and to get this opportunity not only to host, but also to participate in this with such an amazing group of women. So I am honored. And just to be completely transparent, she gave me 3 minutes. So, I'm not gonna be able to tell you too much. But what I can tell you that Kaiser University, and I would like to recognize Ms. Belinda Kaiser, Vice Chancellor of Kaiser University, who is not only on the commission, but also a leader and an example here at Kaiser University, as we have such strong female leadership within our organization, and I'm proud to be a part of this organization. Kaiser University has been providing upskilling, particularly for women, for almost 50 years. We're getting really ready to serve that 50-year anniversary in about 12 to 18 months, and couldn't be prouder. So upskilling isn't something new to us. It's a term, it's a buzzword, right? But as it applies to what all of you are doing and the status of women, Kaiser University serves 80% of our population is adult. And here in Jacksonville, unlike many of the campuses across the state, we've got 19 physical campuses across the state. My population is about 55% women. So if that doesn't speak to you to the necessity of upskilling, right? And those women are working women, are women who have decided it's time for me to get back into the workforce. I'm also thrilled to share with you, and Dr. Norfleet will be happy to hear this. We've just added our 4th cohort of IT, information technology professionals, and we're seeing more and more women not only go into IT, but cybersecurity, which is probably all of you are well aware that cybersecurity is a very in-demand work field and has been dominated by men for quite some time. And Dr. Norfleet is a pioneer in the industry and continues to do so. And so we're really thrilled to contribute to that. I know my time's ticking, so I wanted to just share with you a couple other things about Kaiser University and how we align with the efforts of what your organization is doing. We have been #1 in social mobility ranked by US News and World Reports. And so when you talk about upskilling and social mobility, they go hand in hand, right? We're talking about a university that when our students graduate, they're in a better economic position than they were than when they started. And with 55% of our population being women, they're doing that. They're upskilling themselves. They're making sure that their voices are being heard, not only in our Jacksonville community, but in the state of Florida. So it is an honor to be here. Thank you, Chairwoman Day. I really appreciate the opportunity to speak to all of you and enjoy your sessions.
Thank you. That was awesome. So let me introduce you to the commission and its work.
Women works every day to recognize and support Florida women and girls. Over the years, the Commission has served as a resource and champion for women throughout the state of Florida. We have celebrated their achievements, learned alongside them, and made connections across county lines and city streets. As we continue our efforts each day, we hear the voices of more than 10 million Florida women as we work to collaborate, educate, and celebrate with them.
I am so proud and honored to have served on the Florida Commission on the Status of Women. Through my service, I learned the needs of women and girls in the state of Florida. And that's what actually got me to run for office in the first place. And through the years, I have focused on issues affecting Florida's families, particularly women and girls.
Although there continue to be challenges for women, from underrepresentation in both elective and workplace leadership positions, to struggles with poverty, equal pay, and gender-based violence, we continue to connect women to the resources they need with community listening sessions, lunch and learns, and annual forums to access the legislative process. But these efforts of connection are only bolstered when women's achievements are celebrated through awards such as our Community Achievement Awards, Student Essay Contests, and the Florida Women's Hall of Fame.
The essay contest has really helped me develop my leadership skills, my public speaking skills, and my writing skills. At the Lead Summit, where they present the awards to all the honorees, I was able to present my essay in front of all these important political figures and empowering women. It was so amazing being able to do that and have that opportunity.
So through the Commission's work of educating and inspiring women, I have seen the impact of the women who have come through our summit. I've seen how their lives have been changed, and that makes me extremely proud of the work that the Commission is doing, and I look forward to what we continue to do for the next 30 years.
You know, as a young girl growing up on the space coast of Florida, I was always looking for someone to emulate, somebody who could be my role model. I'm so proud to be joining the ranks of incredible, hardworking women who will be remembered for generations to come.
To continue to help Florida succeed, it's critical that people like you get involved in helping a fellow woman or girl through mentorship, stepping up to a board position, or running for office. We need your involvement with the Commission to continue this legacy. So as we face the next 30 years, join us as we continue to raise up and celebrate women and girls who serve, lead, and pave the way for others.
Join us.
Join us.
Join us.
Join us.
I'm glad you've joined us. In November of 2022, the Florida Commission on the Status of Women contracted with the Public Opinion Resource Laboratory at UNF to gather information about the attitudes and challenges of adult women in the state of Florida. And the goals of the study were to identify key issues facing women, understand the critical needs of women and their communities perceive as important, build trust with constituents, and assimilate diverse points of view of all segments of our population across the state, including young women between the ages of 20 and 24, which is a population that had been underrepresented in our research before. The Public Policy Committee within the Commission chartered a series of roundtable events as a result of the study, where we could bring experts together to highlight the progress being made about resources, to understand what's available in our community, and provide information about initiatives that are going on locally to address the issues voiced in the study. We are here today as the third of 7 that will be held across the state, and we're delighted that North Florida is one of our key areas. Healthcare, including mental health and economic security, are the top 2 issues, and they are largely intertwined. You have a copy, or a copy's been made available to you at registration. If you didn't grab one, I encourage you to pick it up. It's also available on our website, and it's got a lot of detailed information that I hope you find beneficial. I've said to our team as we're putting together our roundtables that these events are not to admire the problem, not to admire our issues, but to acknowledge these issues there and rally together to figure out how do we move forward, how do we make things better, and what's available that maybe we don't even know about. So as we're here today, I hope that when we go through our process that you will leave empowered, informed, and inspired. The version that's available to you, I pointed out just a few key points that are on this slide. But as you'll see, North Florida leads actually economic security. It's on page number 6, which I happen to have this book memorized by now. Page 6 will highlight that to you, that North Florida is that dark bar, and they're very connected. They're very close together. And with us today, I'm so delighted that we've got this powerhouse of facilitators and speakers that will be sharing great information. Their bios are in the program book that you got, so I'm not going to read those to you or go through that. But please spend some time, because these are some amazing women who are contributing their knowledge, expertise, and their passion for women with us today. Let's go ahead and give them a round of applause. And while they do that, I'd like to invite our panelists to come on up. While our panelists come and get seated, I'm going to do a quick walkthrough of our program with you and speak. Commissioner Guy Hudson, that you're welcome to come up too. Sorry. So just to do a walkthrough of the program, this is what I'm considering our general session. And so we're going to have a panel discussion led by Commissioner Jen Guy Hudson, who's with us from Tallahassee. And after the panel discussion, time permitting, we should have time for a couple of questions, Q&A for the panelists or someone on the commission. And then we're going to have a brief networking exercise that we hope won't just be for today, something that we'll take with you as far as the concept of how to make connections. And then after our networking, we will all go upstairs to the 3rd floor. You each have workshops that you'll be attending. There are 2 workshops, they're 30 minutes each, and you'll have some time in between. There's some lovely refreshments that are going to be available, so feel free to take something to drink, something to eat with you as you go into your workshops. We will conclude at the end of the 2nd workshop, so we're not going to come back here. And when we're upstairs, I hope you use that time when the 2nd workshop's over to network, go deeper with some questions, and think about what you might want to share with someone else who may benefit from the information you've learned. And lastly, it's critical that we continue to improve our processes as we take our roundtables to the next city. You have a survey in your packet. We'd love for you to fill that out and leave that either with one of our commissioners, myself, Kim over there, or there's a table upstairs on the 3rd floor that you can leave your survey. It's super important for us to try to make the most meaningful roundtables for you and your constituents in other cities. So I think that's about it. And now it is my pleasure to turn the program over to Commissioner Jen Guy Hudson.
Thank you, Madam Chair. Good afternoon, everyone. It is my privilege to serve as the facilitator of our panel discussion today. Its genesis came out of the survey that Chair Day talked about. And what we learned is thinking about healthcare and economic security. And today's panel is really looking at that those things are so interconnected. A couple of things that we know about healthcare in particular: women sadly make up a majority of those that are uninsured and underinsured. In particular, Duval County doesn't escape that, although I think one of our panelists will probably share some good information recently shared with us by Mayor Deegan on the uninsured question. But we also know that as female leaders, while we may be doing great things in our careers, we live with the specter of cementing our financial and economic security. We know that that is a top of mind challenge for women. We found it in the survey, and I think most of us in this room probably know that as well. So our panelists today, as Chair Day mentioned, their bios are in your program, but they represent pretty much every sector that touches healthcare and economic and financial security. We have policymakers, we have healthcare providers, and we have women as across the board that are moving the needle in entrepreneurship and developing women leaders both here in Jacksonville and across the state. So I would like to get us started with Lynn Sherman, who serves as the Executive Director of Health Programs for Mayor Deegan. Most of you probably are aware that Mayor Deegan is making healthcare and improving the health for Jacksonvillians a centerpiece of her mayoral time, and has a number of initiatives around improving access to primary care, and one that's dear to my heart as a healthcare attorney, which is ER diversion. Lynn, can you talk to us a little bit about what the mayor is doing and some things that she may be doing going forward?
Absolutely. Good evening, everyone. It's great to be here with you all. I really appreciate it. And I am especially proud to be able to share with you what Mayor Deegan's health priorities are. We have selected 6 particular things to focus on, and those things were determined as a result of the transition teams made up of community members who came together, the healthcare experts, and said, these are the deficits, these are the disparities, and this is where we need your help. And so we heard them, and as we heard them, we began to figure out how we can positively impact these areas. And the areas that our focus is maternal and child health, as you can imagine, mental health, elder care, insurance, and social determinants of health, and of course primary care. And as we think about, I want to start with the babies primarily because they are where we all got started, right? And as we think about the span of life, it all begins there. Everything begins there. And so as we think about how we impacted them, I want to share that with you. We're collaborating with nonprofit organizations that work with mothers during preconception, pregnancy, and also postpartum care, in an effort to help educate them and help them to understand themselves, their bodies, and to provide them with resources that they need in order to be healthy, so that the baby, in other words, can be healthy. And so how do we do that? One of the things we're working on is expanding their community health workers. Currently, there are community health workers who specialize in infant mortality care, and they are knocking on doors in areas where there is a high percentage of a high rate of infant mortality. And so when we asked our transition teams how could we do this and impact it in a positive way, it was to add additional community health workers. If they were able to add additional community health workers, at least 2, then they would be able to reach more mothers, at least 200 more mothers a year, which will help us decrease the infant mortality rate. In 2022, 119 babies died. And that's too many. Those are our babies. And that was in Northeast Florida. And the Northeast Florida regional infant mortality rate is about 6.4. The state is 6.0. And so that's still not good. And we need to make a positive impact on how we care for mothers and babies. The overall progress for infant mortality is improving a little because there are people out there doing this work. But at the same time, that did not spiral down to the disparities that we have when it comes to racial disparities and infant mortality. And if you just think about it, the infant mortality death rate was 4.3 per 1,000 live births in white babies compared to 11.7 deaths for black babies. And there are a lot of reasons for that. Co-sleeping, anomalies that babies are born with. There are a lot of reasons for that. But there are reasons that can be addressed in preconception, pregnancy, and postpartum. So we have decided to address things in that respect. And mental health, we are working with, is another one that we're working with 988 and the United Way. The United Way has crisis counselors who answers the mental health calls all the time. They are, once the 988 number came into play, how many of you are aware of 988? Good. So everyone needs to be aware of 988 and the work that's being done around that. So when 988 came to fruition here in Northeast Florida, there was about the calls for the crisis calls increased about 97%. For the United Way. They hired and trained specialized folks to be able to deal with the mental health calls that they received. And with the staff that they have, they were only able to cover about 82% of those people. And so what does that mean? 82% sounds like a really good number. But the others, that were 13% or so, that were not being the calls that were not answered by our United Way were rolling over to the national 988 number. And so what that resulted in was immediately calling 911 or having people Baker acted because the national number didn't understand what the resources were locally. But if the phone is answered by our 988 operators here in Duval, then they're able to refer them to mental health organizations who are ready to receive them. And so that makes all the difference in the world. So how do we support that from the mayor's office? We provided 2 additional 988 crisis operators is all it would take. And so we're providing them with those people in order to keep all of the calls here locally. So we're excited about that.
Lynn?
Yes.
If I may, since you've been talking about 911, one of the projects that I know is really important to the mayor. So we know that women often forego preventative and primary care. And what ends up happening is a lot of women end up showing up in the ER to get the critical acute care that they need. Can you tell us for a moment what the mayor is doing to help address access to primary care and ER diversion?
So absolutely. There are, a lot of our citizens here in Jacksonville who are using the emergency room for their primary care. And as a result, what we are doing is something a little more innovative than we have done in the past, and that is utilizing telehealth to help support ER diversion. There will be, and the way this will work is there will be a number on the city's website for folks to call. And they will call that number and someone will answer the phone within about 15 seconds. Once someone answers the phone, and that will be a nurse, a triage nurse, once that nurse answers the phone, she will then triage the patient, ask a few questions, find out what the issues are with that person, and immediately, while all that is happening, an ER physician is being notified. And the ER physician that's on call, they will be able to talk face-to-face with an emergency room physician. That emergency room physician will then determine whether or not that ear infection that that person has could be handled by simply giving them a prescription for antibiotics. And they're not left there at all. Or if they need to go to the emergency room, is it a real emergency that they need to go to the emergency room for? This it diverts people from going to the emergency room when they have something simple to care for. But it doesn't stop there for them. It doesn't stop there. What will happen, rather than just leave people and not provide any follow-up care, they will be connected directly with Jack's Care Connect. And Jack's Care Connect is sort of this umbrella organization who will refer people to our safety net clinics. And we have several safety net clinics in town. And they will then be connected to those safety net clinics for follow-up. So now they have a primary care and they have a medical home. And this is primarily for uninsured folks. If people call and they have insurance, then we will refer them to their primary care doctor. But if not, they will then be referred to one of our safety net clinics, the one that best meets their needs.
Thank you so much, Lynn. And to that point of accessing primary care, one of our challenges is how do you access primary care? How is it affordable and high quality, in particular for those that are uninsured? Jennifer Ryan, who is the CEO of Volunteers in Medicine, is working directly on that issue, and what a resource it is in Jacksonville. Jennifer, if you could talk to us a little bit about Get Covered, Jax, one of the mayor's initiatives that I know that y'all are working on. And also, if you could spend just a moment, I think some people struggle with the idea that there is such a high uninsured population still in 15 years after the passage of the ACA. So if you could talk to us a little bit about who your patients are and what you are doing for them.
I might need a reminder about those three things, but
No problem.
I'm so happy to be here and love the panel that I'm a part of. These are amazing women in our community. And I do want to give a huge shout out to our mayor and all that Lynn is doing and Dr. Joshi because they really are supporting health in our community. So I run a free clinic for the working uninsured. We rely heavily on volunteer doctors and nurses. We have a small staff, and our goal at Volunteers in Medicine is to fill a gap. We're not trying to replace insurance. We're trying to fill a gap where people don't qualify for certain things. They don't qualify for Medicaid, they don't qualify for the Affordable Care Act, and they can't afford to pay for insurance themselves. So Get Covered Jax was a wonderful initiative that the city undertook during open enrollment of the Affordable Care Act, and it was extremely successful. And it was done very strategically to really focus on the areas and community events and communities that typically have poor access to healthcare. What was it? Oh, why are there so many uninsured? We're gonna go back to that. We say this over and over again. Florida didn't expand Medicaid, so that's one issue. And also, the health departments used to do primary care many moons ago, and they stopped doing it. And that kind of forced us to get into this free clinic area. But people don't think about healthcare until they're sick. What I'm trying to get to people is go to the doctor every year for no reason. What happens in our case is people turn 45, and there's no one in this room that's 45, so you don't understand yet. That's when you start putting on a little bit of weight. You can't see so good, and as we have glasses, and so you're like, oh man, maybe I need to go to the doctor. But what we really need to be thinking is, okay, I'm 40. Do I need to get a mammogram? I'm 45. I need to get a colonoscopy or talk to my doctor about colon cancer screening. But we don't do that because we wait until we're really sick. And you talk about ER diversion. If people don't know what a primary care doctor is, if people don't know what a PCP or what a HMO or that's complex for a lot of people in our community. They know that their friend went to the emergency room and they were fine. If you come to the session that Jackie and I are holding, one of the key things in our society, when you talk about economic mobility, 2/3 of bankruptcies in our country are because of healthcare cost. So if we can get to things early and detect them, we don't have to deal with these expensive costs. Was there another part I missed, or did I get it all?
That was
Did I
it.
get it?
Thank you. Although I do have to give a shout out, again, as someone that worked in healthcare for a very long time, I was unfamiliar with Volunteers in Medicine. And to Jennifer's point, primary care is but one piece of the puzzle. And what I find fascinating and incredible about your organization is you have 16 other services in addition to primary care. So for women who are looking for those other services that she mentioned, that is your provider. And I think it's fascinating. Jennifer said something that has really stuck with me. I had this wonderful opportunity to speak with each of the panelists individually, and I kept going, oh my gosh, they're such rock stars, who am I? And what she said to me that really stuck with me and really kind of, I think, puts a bow on why we're here today is if you're not healthy, you're not working. And I've really spent a lot of time thinking about that, in particular because our next panelist, Jackie Peralt, has been doing incredible work for her entire career around how do you support women entrepreneurs, which we saw in that little healthcare thing that happened a few years ago, COVID, the rise of the solopreneur, who are women. They got into business because they needed to serve a need. They needed to be home caregiving. They needed more flexibility. They needed a job because they no longer had one in COVID. And so Jennifer's work is how you support them, how you scale them up, how you now help launch those businesses. And it really stuck with me about the idea of health and your clients. Talking about your clients, I would love, again, for you to share a little bit of a profile, because I think we often think about entrepreneurs as this sort of kind of amorphous thing that's not me or not my friend. And it was fascinating to me to hear about the women that you serve.
Absolutely, thank you. And thank you for the opportunity. Thank you, Commissioner Day, for this opportunity, and to the entire commission on the Florida status of women, and to my esteemed panelists. Jackie Pearl, and I work with the Association of Women's Business Centers, but before I got into that role on the national level, I actually ran our Women's Business Center right here in Jacksonville, Florida. We have 4 women's business centers in the state, all working to provide free access to resources. They get free business coaching and counseling from Women's Business Center, as well as training opportunities and mentorship. But what we saw during the pandemic, definitely, was the rise of the solopreneur, and that word started to kind of become a buzzword, as well as the SBA became kind of trendy during the pandemic as well. People really didn't understand what the SBA was, what the resources that they offered, and how they kind of deployed resource partners on the ground and grassroots like women's business centers. So they became very popular, but then what happened was they kind of shot themselves in the foot because they didn't understand what a solopreneur was. And the first round of PPP loans that went out did not equate to that solopreneur, which very much so was the woman entrepreneur. So that first round of PPP, women and solopreneurs were ineligible to receive that type of loan efforts from the federal government. And they were forgotten about until the women's business centers kept fighting, and the association actually got $420,000 to each women's business center across the country for them to modernize and increase their programs, allowing them to hire on more staff, more coaches, to give resources out to those solopreneurs. And one thing that has stuck with me the most from what conversations that I'm in with the SBA and across the country is that women didn't leave the workforce. They left the workplace. Right? They didn't leave the workforce. They left the workplace because of the care economy, which includes healthcare, which includes childcare. And during the pandemic, what happened? Students and children were at home. The woman oftentimes is that caretaker, as well as with the elderly. The woman entrepreneur had to step up in new and innovative ways, and they did just that. And they got the resources from the women's business centers. Now, unfortunately, that was a one-time kind of distribution, $420,000 to all these women's business centers, 150 across the country, all the way from Puerto Rico to Alaska. But that was a one-time installation. So now we're working to kind of keep on that modernization and make sure the federal government understands that with that money, we were able to increase our capacity from the rising demand of what was happening from entrepreneurship. Now, 4 years later, which I'm like shocked to even say that, we're still increasing our demand, and you'll learn more in our breakout session, but women rose to the occasion. Women are outpacing their male counterparts in entrepreneurship. Florida continues to rise and be #1 with small business ownership, but that money needs to kind of come up to play, right? When the Women's Business Center Act came into play in 1988, that's also when NABO came into play, when women were unbankable. They were unable to get a business loan without a male relative cosigner in 1988. Unbelievable. During that time also, that's when the women's business centers came into play. They were not indexed to inflation. So 35 years later, our women's business centers are still operating under the same federal funding from 35 years ago. Now, going back to what I just said about the monies that we got during the pandemic, if we can continue that, we would have been indexed to that amount, $400,000. And we can continue to keep on and keep providing those resources. So there's a lot of work to be done. Now I am on the national team. I actually flew in this morning from DC. There was an SBA Women's Summit yesterday. Huge conversation from the administrator, Isabella Guzman, is on childcare. The White House actually on Monday instilled a program to make sure that childcare programs are being instilled and that women's business centers across the country are going to be on the forefront of helping those childcare programs start. So they're going to be able to create, if you want a home childcare program, if you're an entrepreneur and you have a mind that you want to run, we are going to be able to help you with that. I did mention I'm on the national level. There is a Jacksonville Women's Business Center here, but anybody is able to reach out and get resources from the Association of Women's Business Centers. We actually help kind of triage clients as well. There's sometimes people feel like there's not a center near me. So we do that through our Hope to Women platform, and that's hope2women.org, and you can request assistance and get connected to a resource provider nearest you.
Jackie, you've talked a lot about your federal advocacy, which is incredible, and thinking about having to modernize the funding that comes from the feds for your work. I wonder, is there a state funding component, or should there be?
That is a great question, and thank you for bringing that up, because we've had some monumental things happening even just this year. So for the Women's Business Center programs, it is a federal grant that we apply for, and then we match that grant dollar for dollar with private dollars. We have never gone after, in the state of Florida, we have never gone after state funding to help match that federal grant. Through the association work and the 4 WBCs, we have actually went to Tallahassee. We had very successful meetings. We got a first year appropriations, and we got into the budget. So we are waiting, fingers crossed, that we do not get vetoed through now until the budget gets passed in July. But we have actually been very successful in getting state funding for the first time ever. And our Women's Business Center here in Jacksonville has been around for 20 years. Can you imagine if we did that 20 years ago? I'm like, we would have so much more. So it's very exciting work, and more definitely to come.
Thank you. So I'm excited on a personal connection for Damika Jackson to share some of the work she is doing as a commissioner on the state Commission on the Status of Women. Some of you may not know that the Commission on the Status of Women concept flows through from a national commission to a state commission in every state, and also local commissions. And I'm pleased to tell you that the local commission, the Jacksonville Commission, sits in the mayor's office and has been in existence for at least 20 years.
Well over.
And of course, with having the first female mayor in Jacksonville, having our local commission partner, the chair, join us today and talk about the really exciting things that the Jacksonville Commission is doing. If you could share some of those initiatives.
Yes, thank you so much. So the Mayor's Commission on the Status of Women, yes, we have been around well over probably 40 years. Yes. And so we meet on every fourth Monday. We meet, usually it's at the Edward Ball building. However, we have pushed out to where we're meeting at the library in Arlington and moving around a little bit around the city so that we can make it a little more accessible to people in the community. And so what we focus on is education, advocacy, and celebrating our women within Duval County. What we do is we have women come and talk about, one, the challenges that they are facing in the community surrounding healthcare disparities, economic security, and of course, advocacy at a local and state level. We then have those individuals come in, talk about all of those things, and we send a report back to the mayor. And we have those conversations, those courageous conversations, so that we can solidify change within the Duval County area. We are happy to say we have some amazing things coming up. We have what we call courageous conversations, where we have those direct conversations that men don't like to have, especially when it comes to the reproductive system. Yes, they seem to leave the room when we start talking about that. And so we bring in experts to talk about the different laws that are now affecting us as women when it comes to our reproductive rights. We have conversations. Hey, Pat, and she's leading the forefront of that. Also, we bring in experts within different industries to talk about those economic security issues, to talk about how we can address affordable housing. Because we know sometimes the things we've put in place are just not working, and we need a fresh set of eyes to see how we can tackle this for our community. Additionally, we would now like to introduce, we have partnered with the Florida Women on the Run program, and we will be announcing that we will have a kickoff May 4th. This is a bipartisan program that teaches women who want to get into the political arena or community leaders. It's a 6-month program, and it walks them through the whole process so that they can either run at a local, state, or even a federal level. Now, the great thing about this program is just this year alone, and we're already in March? We had 35 women go through this program. 24 of them have been elected. Yes. So we are now bringing that program here to Duval County because we want more women and girls to be fighting the good fight, to advocate on all levels. And honestly, we need some changes in Congress. So we need to make sure that our future is set because we want to ensure that we continue advocating on behalf of our women.
Damika, thank you for sharing. I believe that was the announcement of Women on the Run
Yes.
here in Jacksonville. So,
yes.
I also work for the legislature, and I know firsthand how important recruiting women candidates is. I am pleased to tell you that the largest class of female House and Senate members has been this last term. I'm also very sad to tell you it is still woefully in the minority with numbers. And so programs like Women on the Run are what is going to make the difference directly in my life, but in lives for all women and girls in the state.
Definitely.
Angela Timberlake, who has, in addition to being one of our panelists, has also been incredibly gracious with her time and helping us plan and drive this incredible roundtable. So thank you, Angela. I would love to have some very quippy, amazing transition, but your work is just, it leaves me speechless. And I kept practicing different transitions. And what I really want to do is say, do you, Angela? Tell us what you do.
Thank you. And I just have to say, it's tough to follow all of these amazing women, but Jacksonville has some amazing women. I'm just so proud to be here and proud to do the work that I do every day. I will say, companies are looking for talent. And when they look to Jacksonville, they look for a hot spot of where they can find diverse talent. And we have it all here, right? So if you think about Jacksonville, we have amazing sources of talent. We have, the conditions are just right. The weather, the low taxes, we have a high density of colleges and universities. We're a port city. We have a booming fintech and medical community. And so we have everything that a company would need to relocate or even move or build a headquarters here. And so that's what companies look for. And so I'm going to share some stats with you, just so you're clear on where we are. So Florida is ranked number 2 best states to start a business. Jacksonville is the number 1 city for U.S. job seekers, number 1 for people looking for jobs. We're the number 5th city for international business, 5. It kind of blows you away when you think about it, like we live here. Wilson's Hospital is one of the only 8 top hospitals for children. We have 8 of our Northeast Florida schools ranked in the top 50. And it's the top city for corporate relocations. And that's because we have lower construction costs. We have an average of 25-minute commute, no matter where you are, pretty much. We have close to a million labor force. 55%, as Dr. Winslow said, was women. 55% of our workforce is women. We feel it, don't we? When we look around the room, we're like, most of us are here, except when we get to the boardroom and we get to the C-suite. We're the minority, right? And so, yet, despite all of that, Jacksonville still is not where it needs to be in our executive leadership and representing our diverse population. So we have some work to do, and that's the whole purpose and the mission of Elevate Women. We have so many barriers, whether it's systemic or personal, that we need to break down, and so that's Elevate Women's mission, is to break down those barriers. So, studies have shown, numerous studies show that companies thrive when they have a diverse leadership team. Yet despite that, we're still not where we need to be, globally and locally. So we still have progress we need to do. So as many of you know, this initiative started in the Jacksonville Chamber. It started in July of 2020. That was fun. So it started there, and the best part about it starting at the Jacks Chamber is it became a conversation about economic development and economic security and economic growth for our community. It was not a woman's problem. So that's why we had the success that we did, and that's why we were able to get into the rooms that we needed to be in to have this conversation. So we were able to get in the right places in front of our leadership to talk about why we need to look different from an executive standpoint, how we're gonna get there, and what can we do to move the needle. And so that has been our success story. In less than 3 years, we saw positive change in the boardroom and in the C-suite. So we moved the needle 11% in the C-suite and 3% on boards in just 2.5 years. Yeah. That's great, but we still have a long way to go. But we're going in the right direction. And we're gonna capitalize on that momentum. So unfortunately, the grant, so we were funded by a grant from the Community Foundation based from donors and local leaders who saw that they need to put a stake in the ground to really drive change. And so that grant ended in July of last year, after only 3 years. And so I was disappointed for a day. And then I said, you know what? This can't stop. So I worked with the chamber to take it and transition it out of the chamber. And so now it is an independent nonprofit organization, and we just launched our first program a month ago. So we're gonna continue this work. We are gonna continue to focus on the corporate C-suite as well as the boardroom. And we are going to move towards elected and appointed office as well, because we know there's a need there. There may be a good partnership opportunity there. And then we're gonna look for access for women business owners. We know access to capital is a huge need for women business in this area. So those are gonna be our key things that we'll continue to look for. We are funded by community activists and businesses who believe that investing in the power of women just makes good business sense. And so we're gonna continue that work. We have more work to do, but I always like to leave you with something. So if you don't come to my session, mine and Dr. Northfleet's session, I wanna give you something to take away with you. So 4 suggestions for your professional journey. Create your own circle. Create your own tribe. Have a small group of people that are gonna hold you accountable, that are gonna push you forward and drive your success. Expand your network with key leaders. In the work that I do, no one is selected into those roles that they didn't already know somebody there. So you need to know those people. Know your value statement. If you're in front of somebody, a CEO or a board member, in 5 seconds or less, tell them why you're valuable. That's hard to do. If you need help doing that, invest in a personal coach. So I always suggest in having an executive and leadership coach. So I'm happy to talk more about what we do. I'll be here for the rest of the day, or find me on LinkedIn.
Before I share my profound gratitude to each of our panelists for taking your time to share your talent and your treasure with us, I want to check with Madam Chair, do we have time to take a question or two? Okay. Would anyone like to ask a question of our panelists before we conclude? Is everybody just waiting and holding their questions till the workshops? Then why don't I go ahead and conclude so that we can do our networking and then move on to our workshops. Again, thank you to each of you. We are grateful and we look forward to supporting you, helping you, and watching incredible things that y'all do. Angela.